Hi, my name is Anita Kennedy, and I'm a peer engagement specialist with Mount Sinai Beth Israel. I do community outreach in the East Harlem community, and I am going to tell you today about Narcan or Naloxone to reverse an opioid overdose. You might have heard recently about where the West Point cadets were away on spring break. They were intending to use cocaine recreationally and found that the cocaine they were using was laced with fentanyl. Fentanyl is a very dangerous drug and it's causing many opioid overdoses. Today, I'm going to tell you about how you can reverse an opioid overdose with Narcan or Naloxone. Naloxone is the generic name and Narcan is the brand name, and I could use them interchangeably. Using Narcan is not just for people who are homeless or people who are using drugs on the street. This is also for people that may have had a surgery or had a dental procedure and they've gotten some kind of pain medication, and they could potentially bring that home, put it into a medicine cabinet, and somebody who is not intended to use that could get a hold of it, and then they could actually overdose. That has happened before, where a person had hip surgery and the grandchild got a hold of the medication, the pain medication, and actually overdosed. Thankfully, the person had just been trained recently and had Narcan on hand. Some common opioids are heroin and prescription painkillers such as OxyContin, Percocet, Vicodin, and even methadone. This even works on non-pharmaceutical fentanyl, which is 50 to 100 times stronger than morphine. It does not work for cocaine, crack, the benzodiazepines, methamphetamine, unless there is fentanyl in those medications, in those drugs. Some signs of an opioid overdose would be somebody who is unconscious or unresponsive. Now, here in New York City, we have a lot of people who are out on the street and they may be homeless or they may just be sitting down, relaxing in the street. So you can stand and observe a person and you can see if maybe possibly they're having an opioid overdose. The person might be slow breathing, or they might have actually stopped breathing. They have blue or gray lips or fingernails, or if they are breathing, they're making a snoring or a gurgling sound. These are some signs of the opioid overdose. So what would you do? If you were to come across somebody and they're having an opioid overdose, or you think they're having an opioid overdose, you'd want to check for responsiveness. If the person is having slow breathing, or they have blue or gray lips or fingernails, you'll want to try to shout at them, wake them up, tell them, I'm going to call 911 or I'm going to give you Narcan. And that's something that is quite uncomfortable for somebody because you're sending them into immediate withdrawal. Also, you can make a fist and rub and do the sternal grind, and this would cause pain to a person enough to wake them up. Before rendering aid to anyone, you should always call 911 first and ensure that there is an ambulance or EMS, some kind of emergency personnel on the way. So now I'm going to tell you how to give Narcan or Naloxone. This is for the nasal spray. So in each kit, you'll get, this is the blue bag that you'll get. And in each bag, there'll be 2 doses of Narcan. There's also gloves, a face shield that you'll put on if you're going to do rescue breathing and CPR. And then also instructions, because this is a lot of information that I've given today. Also very important is the certificate of completion for someone who has taken the training course. and is now certified to be able to administer Narcan. When you first give Narcan, you'll want to put on the gloves, and then you'll take one of the Narcan nasal spray and you will peel it back gently, place it inside the nostril, and press. There is no need to test the medication before giving it, and you don't have to prime it or anything like that. All the medication that's in here needs to go inside the person. So you'll take a nice giant step back, and then you'll observe the person for 2 minutes. Okay? I'm telling you to take a step back because if the person does wake up, they may be a little agitated or fearful for what's going on. They might not know what is actually happening to them. So they could be afraid or they could be agitated. So you're gonna wait 2 minutes. After 2 minutes, if the person is still unresponsive, you will take the second dose, peel it, place it in the other nostril, and press. So peel, place, press. After that, if the person is still unresponsive, you have a choice of doing 2 things. The first would be that if you're trained and comfortable to do so, you could do rescue breathing or CPR. And at that time, you would take the face shield. You would take the face shield and you would put that over the person and you could do the rescue breathing. If you are not trained to do CPR and you are not comfortable doing CPR, you can then put the person into the recovery position. Okay, the recovery position is the person's hand is going to be supporting their head's going to be tilted back just a little bit to open the airway, and their knee is going to be bent just enough so they're not rolling over onto their stomach. This is because you have just caused them to go into withdrawals, and they could potentially choke on their own vomit if they do vomit. Okay, if the person wakes up, you will want to tell the person what happened. Remember, you're going to stand back at a little bit of a distance because they could be upset or they could be frightened or they could be having the effects of the withdrawal and they could vomit. So you want to tell them what happened. You had to administer Narcan to them for an opioid overdose. Remind them that Narcan works for 30 to 90 minutes and it may cause withdrawal symptoms until it wears off. At this time, you'll also remind them that they do not want to use any more drugs. Even if they were to use drugs, it would not be effective. They wouldn't feel it at all because they have the Narcan blocking the receptor in the brain. In fact, it may set them up for a second overdose. So this is something that they'll want to avoid. It's going to be uncomfortable for that amount of time. However, it's just something that they're going to have to go through until it wears off. And hopefully by this time, EMS is there. If you use your kit, you will want to replace it. You'll want to also make a report. You can complete an anonymous report at the program or wherever you've received the kit. Or if you would like, you can make an anonymous report at Stop OD NYC. That's printed on the blue pouch that gives that has the Narcan in it, and it gives all of the information on the outside of the pouch. You'll want to replace your Narcan kit if you use 1 or more doses, if you lose your kit, or if it's damaged in any way, or if it expires or is near expiration. Yes, the general public can get Narcan spray. They can do this by going to a number of pharmacies. Typically, the larger chain pharmacies have the Narcan available free of charge. And also, people will be able to get this with their insurance as well. Their insurance covers it. And so you would just have to ask for it at the pharmacy. Okay, so it takes anywhere between 2 to 5 minutes to work. That's why it's really important. That's why it's really important to make sure that you only wait 2 minutes, because fentanyl is so strong, and we are going to assume that a lot of these drugs now have fentanyl in it. And so you'll want to give the second dose after 2 minutes if the person is not responsive, but it typically takes anywhere between 2 and 5 minutes for a person to feel the effects of this. 1 dose typically is not enough. However, you know, that's why there's the second dose in each kit. Oftentimes now you'll see that there are a lot of bars that are and nightclubs that are carrying Narcan. In fact, I've done trainings at different restaurants. I've done trainings for stores in the neighborhood. I've done trainings with many different organizations in the neighborhood, adult care centers, like the adult day centers, different bars, nightclubs, restaurants, anything like that. So a lot of people are on board with having this life-saving medication at hand. You can get in-person training by contacting me, and I would be more than happy to give you a training and a kit.